Hello everyone, this is my presentation on my microbe, which is Mycobacterium tuberculosis, and this is by myself, Lauren Brown. To start off with, we're going to go over some characteristics of Mycobacterium tuberculosis. So it is a small, rod-shaped bacteria, which is identified by doing an acid-fast stain. It is an anaerobic organism, and it is chemotrophic. One of its unique characteristics is the fact that it's slow growing. It can take up to 3 weeks to form visible colonies on agar plates. It was identified in 1882 by Robert Koch as the causative agent of tuberculosis. It has a unique and tough cell wall, which makes it such a powerful pathogen. Although the cell wall becomes its weakness, as that is what it's targeted by antibiotics. And you can see over here on the right, I've got a picture which kind of goes over some of its characteristics, as I mentioned. It mentions that it's aerobic, rod-shaped. It shows its waxy cell wall, which you can see is very thick. And then you see the acid-fast stain there. It stains as bright red. So how it affects humans. So it was the leading cause of mortality from a single infectious agent. And then when COVID happened, that kind of took its place as that number one cause of mortality. And now that the COVID-19 pandemic has calmed down, tuberculosis has kind of taken back its role as the number one cause of mortality. And it also results in twice as many deaths as HIV and AIDS would. A majority of those people who are exposed to Mycobacterium tuberculosis, they never develop an active tuberculosis infection, or they are asymptomatic, although it's still important to remember that the bacteria is highly infectious and can lead to a serious infection. It is estimated that 2 billion people at a time are latently affected by Mycobacterium tuberculosis, so there's kind of a global living reservoir for the microbe. Tuberculosis infection is spread by airborne droplets, and it can either be killed on or in the body by the immune system. It can remain in a latent state, as I mentioned, and kind of contribute to that living reservoir, or it can progress into an active infection if your immune system isn't able to get rid of it. So continuing on, some symptoms of an active tuberculosis infection. It depends on where in the body the infection is, but some common symptoms are a persistent cough, chest pain, blood in the sputum, fatigue, loss of appetite and weight loss, fever, and night sweats. As many of you know, tuberculosis is most commonly found in the lungs. When it is an infection in other parts of the body, it's referred to as an extrapulmonary tuberculosis. And some examples of other places where tuberculosis can be found within the body as an infection include in the bones, joints, kidneys, brain, heart, intestines, etc. So it can be found in many other places within the body. But of course, it's most commonly in the lungs. And so here on my picture, over on the right, you can see that latent tuberculosis, it'll be asymptomatic and you are unable to spread the disease. But when you have an active tuberculosis infection, of course, you have symptoms and you are able to spread the disease to other people. For diagnosis and testing of tuberculosis, the gold standard is confirmation by a culture. So obtaining a sample and culturing it, and then identifying tuberculosis by using the acid-fast stain is the ideal method and the most accurate. Although obtaining an accurate sample can be difficult, especially the slow-growing characteristics of the bacteria can make this difficult as well. A chest X-ray is the preferred initial screening used to assess the presence of pulmonary lesions, as well as other infectious injuries caused by tuberculosis. The Mantoux, if I'm saying that right, skin test is a very common diagnostic test that was developed in 1909, and it's still used today to screen for latent tuberculosis. So many of you may have received this test before. It's where they inject a small amount of liquid under your skin, and if it bubbles up, that means that you are positive and you do have latent tuberculosis. Now to go over how you would treat a tuberculosis infection. So the treatment preferences have improved and changed over the years. Because of antibiotic resistance, you have to change up what treatments you use. So current treatment recommendations by the CDC for an active tuberculosis infection has a 2-phase process. For phase 1, the patient is instructed to take a set of 4 antibiotics daily for 8 weeks. And there's the set of 4 antibiotics you can see there. I'm not even going to try to pronounce them because I'm going to butcher it. But phase 2 is the continuation phase lasting an additional 9 weeks. You can see it's still 3 of the same antibiotics, except the one that starts with a P has been cut out for phase 2. And so to go briefly over antibiotic resistance, drug-resistant Mycobacterium tuberculosis is often due to the improper usage of antimicrobial therapy, such as incorrect antibiotic combinations or duration of drug treatment. So, for example, you might see this if a patient, they start feeling better and they stop taking their antibiotics. That kind of leads the bacteria to develop that antibiotic resistance. The Mycobacterium drug resistance is classified into 5 categories, depending on the type and quantity of antibiotics the Mycobacterium tuberculosis is resistant to. And I won't go over each of the 5 categories, but I will mention that the 5th category, which is the most severe, is called extensively drug resistant. Like I said, it's the most progressed form, and it's characterized by being resistant to multiple antibiotics. Strains of Mycobacterium tuberculosis that are resistant to key antibiotics, they have significantly hindered the ability for the epidemic to be brought under control. And then here is the list of my references, and thank you for watching.